how would you define the idea of value-based care?
We've talked a lot about value-based care and what it means, and I've heard a couple of people answer this question, right? One of the answers I really like is certainly the money that we put in, we want to see get back out in outcomes and value. And I think for me, value-based care is more personal. It feels like yes, we absolutely want that. And we if we can truly transition to a value-based care modality in the country, then that means all the patients are safer. It means we're getting the best outcomes we possibly can. And when we think about our most vulnerable populations, right? That means we can feel safe and secure taking our grandparents to a hospital setting or
Mm,
to a rehab setting or wherever we all need to be. We're all going to get there eventually. um, and trust that we are getting the outcomes that we need. And I think without an eye to the value of how much does this cost versus how much comes out, we end up instead being in a situation where we throw more money into a system that isn't working as well as it could, and we're not getting as good of outcomes even as countries that throw less money at it. Which is why finance always ends up being a part of it. We always want to talk about it from the human element and from the compassion and care perspective. But how else do we measure if we are getting the value out unless we also look at cost?
mm.